Hi, Mishin.
Hi doctor, are you meeting with the patient now?
Yes, I'm currently in the Zoom meeting with her. Good morning, Miss Kara. My name is Dr. Quack. How are you doing today?
Doing good.
Okay, it's great to hear that you are doing well. Okay, I'm the doctor in charge of this study that you're involved in. The purpose of today's consultation is to introduce you to this study where metastatic epithelial cancer patients are recruited. Okay, so I'm here to explain what you need to know before consenting to be part of this trial. So please be assured that you may drop out of this trial anytime you wish to do so. Okay, so if you have any questions, please do feel free to ask me.
Right, I will.
Okay. So this study involves the compound that is able to specifically target your cancer cells, and we are testing its safety and potential clinical benefits. Your record shows that you are eligible for this study, and the following image that I am about to share with you presents the inclusion criteria. So please take a look. Okay, Miss Kara, you have no further questions. Our CRC Minshin will now bring you to another room to do your informed consent and also to do some baseline tests. Bye-bye.
Hi doctor, I have a question. How will the drug dosing be reduced if there is an unacceptable adverse event?
So in the case of an unacceptable AE, we will wait 1 week to look at the conditions. So let's say if the condition drops from grade 2 to grade 1 or healthy condition, we will continue dosing in that week but at a 25% dose reduction. However, if the grade continues and remains at grade 2, we will then However, if the grade remains at grade 2, we will then start the dosing at a 50% dose reduction instead. And after this cycle, if the condition remains at grade 2, this participant will then be terminated from this study.
Oh, I see. What about the grade 3 adverse event?
If the patient has a grade 3 adverse event, the patient might be terminated depending on the protocol. And then after that, we will add 3 more patients to this study. Come take a look. Okay, after adding 3 patients, if all of the patients do not experience any dose-limiting toxicity, which means grade 3 or above adverse events, we will then escalate the dose level to 12 mg per kg. However, if more than one of these patients experience dose-limiting toxicity, then the dose level would be capped at 4 mg per kg as the maximum tolerated dose. Okay, so another thing for you to take note will be the infusion rate. So it should be done as a slow infusion instead of push or bolus. If the vital signs remain stable and in absence of infusion reactions, then the infusion rate can be incrementally advanced following the suggested guidelines as shown in this table.
Thank you doctor. I will now bring the patient to do informed consent and other tests.
Alright.
Hi doctor, this is the blood test result from Miss Kyra for pre-cycle 2.
Thank you. Okay, it looks like the glucose levels, the neutrophils and the platelets are not really in the healthy range. And according to the CT-CAE rubrics, we can identify that as a grade 2 AE. Okay, please tell Ms. Kyra that she will not be able to take her dosing this week until her condition improves to a grade 1 or healthy range. Alright, looks like we will see her next week.
Okay, I will inform her. Thank you doctor.
Welcome.
1 week later.
Hi doctor, remember Miss Kyra didn't manage to get her dose last week? This is her blood test result. This is her blood test result.
Oh, thank you. Okay, so it looks like The glucose, neutrophils, and platelets are back to grade 1. So we can continue with the 25% reduction for this week.
Okay, I will inform her. Thank you.